All right, joining us now on the show for our weekly What's Up Doc segment from Mercy Health, it is Dr. Jeffery Smith. He's a board-certified cardiologist and electrophysiologist over at Mercy Health. Did I say all those words right, Doctor?
That's right, Joe. Cardiac electrophysiology.
That's very good. It's impressive when I'm not even really sure what all the words mean. I know what the cardiologist part is. What explain the second half of your title there to us.
Certainly. First of all, thanks for having me on WROK with you today, Joe.
Not a problem,
it's a pleasure to be here. Cardiologists fall into two major categories, plumbers and electricians. The plumbers treat valve trouble, weak heart, clogged arteries. The electricians, like myself, the electrophysiologists, treat the electrical problems of the heart, either racing heartbeat or too slow of a heartbeat. And the racing heartbeats come in a variety of forms, some of which lead to cardiac arrest. So I'm an electrician of the heart.
So that's pretty good. I like that. I like that description. What kind of patients do you generally see with your practice?
My patient population runs the gamut from the young to the elderly. There's young people who may have been born with electrical short circuits in their heart that make their heart race. That's called supraventricular tachycardia, or SVT. And for those patients, one of the treatments we use that other doctors don't use is called a catheter ablation. We can actually slide catheters through the veins up to the heart and either burn or freeze little electrical short circuits, little extra connections that they were born with, and get rid of their problem of a racing heart. At the other end of the age spectrum, I have patients who've had a variety of heart conditions, maybe an old heart attack or a weak heart muscle, and they end up with a weak heart that causes congestive heart failure. And we implant special devices like pacemakers that can shock the heart out of a cardiac arrest. That's a defibrillator, or a special kind of pacemaker that can pace both chambers of the heart simultaneously to improve the strength of the heart. So I see a wide variety of patient population.
Now, no offense here, but a cardiologist is somebody that no one really ever wants to go see. I'm not counting down the days for my first cardiology appointment, and honestly, I never really think about my heart. It's just there. It's been beaten for about 40 years now, doing a good job. I don't really notice anything different going on with my heart. What kind of things might pop up in my everyday life, feelings, sensations, whatever, that might lead me to call someone like you?
The types of symptoms from the heart that a person should seek medical attention include chest pain, which could be due to a clogged artery of the heart, shortness of breath, which could be due to either a valve trouble or a weak heart muscle, any kind of palpitations. And by palpitations, I mean a sensation of your heartbeat, either strong or rapid or irregular. A fainting spell. If somebody loses consciousness and then they wake up, they come back to normal, that could be a sign of a heart problem. So for any of those conditions, we would recommend seeking a cardiac evaluation.
There's an old wives' tale that I don't really know the specifics on, but they say, upper right chest pain versus upper left or lower. Is there a rule of thumb that one side's better or worse than the other if you're feeling any pain?
The type of chest sensation that's most likely seen with a heart condition, with heart attack or with angina, which is sort of a threatening heart attack, is more of a chest squeezing or heaviness or tightness as opposed to a sharp pain. It's often on the left side, sometimes radiating down the left arm or up the neck to the jaw. But there's a wide variation in the types of symptoms that someone might present with. We particularly see in our female patients that their symptoms may be atypical. In other words, not the classical symptom that I just described, but certainly if somebody had chest pressure or squeezing, particularly if it's associated with shortness of breath or breaking out in a sweat or getting nauseated, those are the types of things that I would evaluate for the heart.
We are talking with Dr. Jeffery Smith, a board-certified cardiologist and electrophysiologist. Did I do that right again?
That's right, Joe.
All right, I'm getting really good at this. Over at Mercy Health, he joins us for our weekly What's Up Doc segment from Mercy Health. So, all right, so I've taken the plunge and I felt something a little bit odd. I give you a call. You say, "Yeah, come on in." The unknown is always, I think, way more scarier than the known. What are we going to do when I come into your office?
Okay. For the if somebody's having chest symptoms, we might do either some type of stress test, which can be on a treadmill or with a chemical to stress the heart, and simultaneously imaging the heart, either with ultrasound, which is called echocardiogram, or a nuclear scan. If somebody's symptoms are so obviously from the heart, or if the stress test is abnormal, we would then proceed with a cardiac catheterization, also called an angiogram. And in the cardiac catheterization, the interventional cardiologist thread a narrow tube up the artery, usually in the wrist or sometimes in the leg, but thread a narrow tube up the artery to the heart and inject dye in the specific arteries that supply blood to the heart itself, looking for any clogged arteries. If they find some, they might open it with a balloon or a stent. Certainly in severe cases, a person might need bypass surgery. And in all cases, we would definitely treat with medications. For arrhythmias of the heart, if you came to me and you were having a racing heartbeat, or if you were having episodes where you were losing consciousness, I would try to find out what kind of rapid or slow heartbeat you might be experiencing. If it was just a common faint, I might just give you reassurance. If you were having it frequently, I might treat it with medications. But if it's something more severe, a slow heartbeat could be treated with a pacemaker. A rapid heartbeat from the upper chamber could be treated with catheter ablation to cauterize an electrical short circuit and get rid of the problem. If you're prone to dangerous rapid heartbeats from the lower chamber, that's what causes cardiac arrest. For those patients, we implant a defibrillator. And a defibrillator is like having a paramedic with you right inside your chest 24 hours a day. It'll detect a cardiac arrest and shock the heart back to normal all by itself.
It's amazing what we're doing these days.
Yes, quite a bit of technology, particularly in the 25 years that I've been doing electrophysiology here in Rockford. There's been so many advances in the arrhythmia aspect of the heart, the electrophysiology.
Yeah, I'm guessing, even like 5 years ago, it's been some wild changes, right?
Yes, and my partner, Dr. Nara, is doing some advanced ablation techniques for a variety of arrhythmias that we didn't treat with ablation, back when I came out of my training, and she's brought a lot of new technology to the Rockford area, so we're very lucky to have her at Mercy Health.
That's outstanding. Now let's say I'm stubborn and I don't like going to the doctor very much, and I ignore some of the symptoms that we talked about earlier in this chat. How much worse am I making it for myself? What could you have done to me, today, as opposed to I let it grow and fester, and now we got to do this in 9 months, a year, 2 years? What am I getting myself into by not taking care of it?
Well, Joe, you bring up a good point, particularly in light of the COVID area that we're currently experiencing. A lot of people are avoiding treating their health care, and we have to remember that though life may be on pause, your health is not, because ignoring symptoms of heart disease may lead to a heart attack, it may lead to a damaged heart muscle, which is called congestive heart failure, or it may lead to death. And during an acute heart attack, what we call myocardial infarction, during an acute heart attack, time is muscle. The quicker we open up that artery, the more heart muscle is saved, the less damage, and the better prognosis. And when I'm talking about time, I'm talking about getting that artery open within 1 hour of the onset of symptoms, within 60 minutes. So we can't put off going to the hospital for a day or two or a week, because we'll have more damage and more death.
Say I'm out on the golf course and my buddy is exhibiting signs of a heart attack. What can I do right there next to him to help him out to make sure he's to up his chances of making it through it?
Good idea. If you're with someone who starts experiencing signs of a heart attack, which would be severe chest pain, chest pressure, shortness of breath, call 911. If you have an aspirin, give them an aspirin. If someone goes into cardiac arrest, which is different than a heart attack, cardiac arrest is when the heart rhythm goes so haywire that it's not pumping any blood and they lose consciousness. Those are the patients where, in addition to calling 911, you have to start CPR and grab the automatic external defibrillator. Every golf course in the Winnebago County is equipped with an automatic external defibrillator. You rip off their shirt, apply the adhesive pads, and turn it on, and it does everything for you. So that's a cardiac arrest. That's slightly different than a heart attack, although they can both happen at the same time. but that's been proven to save lives.
You hinted on it a little bit earlier, but the coronavirus threw a monkey wrench into a lot of things. Other than the PPE, the social distancing, that kind of thing. Your office back up running close to normal, like what we were a couple months ago.
We are back up running now. We have, when the COVID restrictions first came into place, we canceled routine office visits. We canceled elective cardiac procedures. We did telehealth office visits for about a week or two, and now for the last couple of weeks, we've been back to full office visits. And we've taken several precautions to make sure that patients are safe. Patient safety is goal number one. And so in addition to universal precautions, which is washing your hands before and after each patient, every Mercy Health hospital and clinic has added multiple layers of safety precautions to protect both the patient as well as the staff. We have our mask on policy. That means every patient, every staff member, every visitor must wear a mask in Mercy Health facilities. All frontline workers, if you're meeting with a patient, we also have the face shield, the plastic face shield that comes down over our eyes and mask. At the door of every facility, we're doing temperature checks and screening questions about whether the person's been having a fever or a cough, etc. We have multiple hand sanitizer dispensers. We're practicing social distancing in the waiting rooms, social distancing in the lines at desks, and when waiting for tests, and even within our exam rooms. We're using larger exam rooms when available. We're positioning patients as far away as possible from the provider. We're asking for as few family members with the patient at the time. We're spacing out the timing of office visits. We're increasing the frequency of scheduled cleaning of common spaces. The common spaces would be your waiting rooms, elevators, bathrooms, doorknobs, light switches. Mm-hmm. We're also doing rigorous cleaning of the exam rooms between each patient. We're disinfecting blood pressure cuffs, stethoscopes, ECG machines. So we're taking all these steps to make the outpatient experience safe. And once again, the reason we want it to be safe is because we have found out worldwide that people are avoiding seeking medical help because of COVID. Globally, there's been a 50% decrease in patients seeking care for a heart attack. That's based on a survey of 3,000 health providers at 140 countries. In northern Italy alone, there's been a 30% decrease in admissions for what we call acute coronary syndromes. That's either heart attacks or threatening heart attacks. At 9 leading U.S. health centers, there's been a 38% decrease in acute angioplasty and stent for heart attack. And these are all just in the past couple months with the COVID. In Northern California, there was a 48% decrease in admissions for heart attacks. Now, we wish all that meant that less people were having heart attacks, mm-hmm. but unfortunately it doesn't. It just means people aren't seeking treatment. So we want to encourage you to seek treatment, particularly if you have symptoms of chest pain, chest pressure, shortness of breath, swelling, decreased endurance, jaw pain, passing out. You had asked me before, and I had mentioned that we had discontinued elective cardiac procedures. Mm-hmm. I want patients to know that we're back up and running and that we've taken precautions to make their elective cardiac procedures safe. For example, we're doing COVID-19 testing prior to elective procedures. If somebody needs an emergency angiogram, we're doing rapid COVID-19 screening. We're increasing the time between cardiac cases in the cardiac cath lab to allow more filtering of air, extra cleaning of each room and equipment between cases. And we're also, you should keep in mind that the COVID-19 patients or patients with suspected COVID-19 patients are treated in dedicated hospital wards, separate from the other patients. In fact, at Mercy Health, it's in a separate campus, and their rooms have negative pressure ventilation, which prevents infections from getting out. So the other patients who have other medical issues are protected and kept safe and don't need to worry about contracting COVID when they're in the hospital having the medical care that they so richly deserve.
That's good stuff. So this is Dr. Jeffery Smith. Thanks a lot for coming on with us today. Before I let you go, anything we didn't get to that you wanted to cover?
Joe, thanks for having me on WROK. I think that you've done a good job covering the things the patients need to know. I would especially emphasize that although life may be on pause, your health is not. So if you're having cardiac symptoms or if you need your routine cardiac preventive care for blood pressure, diabetes, cholesterol, don't delay, don't put it off. Schedule an appointment with your primary caregiver. Precautions are being taken to ensure your safety. And as things return to normal, we want to make sure that your health stays as good as it can be, and that we all take care of each other's health.
Awesome. Thanks a lot for joining us. It's Dr. Jeffery Smith. I'm not going to try to say it again. He's one of the heart guys over at Mercy Health. Have a good day, doctor, all right?
Thank you, Joe. Have a good day and stay safe.
We'll be back after this.